Hello, my name is Dr. Vincent, and I'm going to be conducting your hearing test today. So firstly, may I please have your name and your date of birth? It's very nice to meet you. So I understand that you recently had your yearly physical and you were looking to follow it up with a more extensive hearing test. Was there any reason for that? Because your chart indicates that your ears are in good health according to your general physician. So I was just wondering if anything in particular precipitated this visit. Have you noticed any changes to your hearing lately? Things of that sort. No changes to your hearing. Okay, good. That's what we like to hear. So what is it exactly that brings you in today? Oh, I see. So you have a parent who has incurred some hearing loss over the years. Significant hearing loss, okay. And which parent, may I ask? Okay, and may I ask his occupation? Okay, so that does make sense. Unfortunately, we do tend to lose some of our range of hearing over the years, and this natural process can be expedited or, in some cases, worsened by some environmental factors, especially if they are environmental factors we are exposed to for long durations, as you would be in the workplace. So there are certain professions where we see this kind of industrial deafness or occupational deafness more. We may see it in someone who works construction. We may see it in someone who works in public transportation. We may see it in someone who works a lot in concert settings or certain venues where there tends to be a lot of noise. So this phenomenon, industrial deafness or occupational deafness, sometimes referred to as noise-induced hearing loss, is very normal. That's not to say some people aren't predisposed to it. For example, there are some studies that suggest that redheads are more inclined to industrial deafness. So what I would say is that the best prevention of noise-induced hearing loss is knowledge, understanding what causes it. Hearing loss is supposed to occur in most people at around 90 decibels. So you probably know that sound is measured in decibels, and it actually correlates to pressure. So we hear through vibrations, and some vibrations put too much pressure on the eardrum. So anything over, say, 90 decibels for humans. Now the problem is that a lot of noises in our normal environments can go well beyond 90 decibels. For example, standing in the subway on average exposes you to sounds at around 80 decibels, but the sound of a passing subway train can actually go as high as 106 decibels. So what I would suggest is invest in a pair of earplugs and keep them on your person as often as you can, because sometimes we aren't expecting to need to protect our ears or protect our hearing. Sometimes we aren't expecting the health of our hearing to even be at stake. Sometimes I'll go to a movie and find that they are playing it at a much higher volume than usual. And certain sequences, especially action sequences, can be very loud. In those moments, I will definitely opt for earplugs, knowing that I'll probably be able to hear every moment of the film just as well, but it won't be blaring in my ears. Because if the film is that loud, odds are you'll be able to hear every moment, even through earplugs, but you are just lessening the pressure being put on your eardrums. For this reason, it is one of my pet peeves when a movie is poorly mixed. So you'll have a sequence with dialogue, which is at one level, and then a sequence with action, which is at a completely different sound level. So if you're using earplugs to defend against the louder moments, you're missing a lot of the dialogue. It's normal for scenes to vary in terms of how loud they are, but you'll start to notice, if you're paying attention like I do, that some movies are impossibly mixed, so that even at home, you're constantly turning the volume up and turning it down and turning the volume up and turning it down, because there's just such a disparity between the inherent volume of one part of the movie and the very next. So all I can say is do your best. You don't need to do a perfect job, but your ears are more sensitive than you think. So just be cognizant of that when you're playing loud music in your car, or when you're walking around the city and the traffic noises are really loud. When I'm at a concert or at a movie and I wasn't expecting to need my earplugs, if I'm really desperate, I'll get a napkin at the concession stand and roll pieces of it up into little makeshift earplugs. Just a suggestion. Now, even though I'm fairly confident that your father's hearing loss was a case of occupational deafness or noise-induced hearing loss, I do think it's a good idea to go ahead with the exam and confirm your GP's findings, just to make sure your ears are in optimal health, especially if you have a family history of significant hearing loss, okay? For an exam like this, there's never any harm in checking, so I always say, when in doubt, make the appointment. Now, it's my understanding that you requested an extended exam, is that right? Okay, good. So that pertains primarily to the final portion of the exam, so everything up till that point should be pretty standard, okay? Okay, good. So first, I'm going to examine your ears with an otoscope, so if you'll turn, please. Do you mind if I pull on your ear just a little? Perfect. Okay, good. Very nice. Now could you please turn to the other side? Very nice. So, I'd just like to take a moment to discuss cotton swabs. I know it sounds like an accusation, but I'm just saying that I of course noticed that your ears are extremely clean, and that's a wonderful thing, but I just want to caution you, as every good ear doctor will, against overusing cotton swabs and over-cleaning the ears. Try to limit your ablutions to the outer ear, and maybe make a rule for yourself that you're only going to worry about whatever someone could see with their naked eye. I would discourage you from going too deep, because odds are you're just going to push whatever is in there deeper down. Not to mention that you may be feeling something that isn't necessarily earwax. It could be inflammation, irritation, allergies. Certain issues can create the sensation of something in the ear, so if it bothers you enough, rather than going excavating in your ears on your own, which can cause a lot of damage, come see me again, or book an appointment with an otolaryngologist, otherwise known as an ear, nose, and throat doctor. Okay? Okay, that's the last I'm going to say about it. I know that it's hard advice to follow, and it's probably one of the most commonly disregarded pieces of medical advice that we as doctors give, because it feels really good to clean your ear with a cotton swab. I just wouldn't want you pushing water deeper into your ear or doing anything like that, okay? Good. Okay, for the next portion of this exam, you're going to put these over your ears, and you're going to raise your hand when you hear a tone of any kind. I'm going to test you from about 90 hertz up through 700. Okay? Is that comfortable? Sorry. Is that comfortable? Good. Okay, perfect. Now, the only one that you seemed to miss was around 90 hertz, which is totally normal for your age. Okay? Yes, it's very low end. I know it's easy to obsess over these things, but the truth is that no one makes it all the way through life with all their range of hearing perfectly intact. There were a lot of tones that my father couldn't hear because he was once carried by a bomb about 20 yards and landed really hard on his back. And some of his doctors have speculated that his limited range of hearing could be related. He heard pretty well, but he definitely had some noise-induced hearing loss. And, I mean, that will do it, right? I just don't want you to be scared of it. Take good care of your ears, but you also have to live your life. Okay? Okay, so this last test is my personal favorite. I'm going to speak some words into your ears. I'm going to start on one side and then repeat the list of words with the other side. And all I need you to do is raise your hand if you aren't 100% certain of the word I've said. Now, I mean this in a phonetic sense. I don't mean if you're not 100% sure of the definition, but just if you don't even recognize it sonically. Okay? So, for example, when I say rough house, you recognize the word I'm saying, right? Okay, so it's going to be like that. So again, I don't need you to know the word denotatively, just phonetically. So basically, I would like you to alert me if you can't tell, for example, between a B sound and a D sound. It's pretty subjective, so when in doubt, just raise your hand and we'll get to the bottom of it, okay? Basically, we're just trying to figure out if there are any sounds, especially on the high end, that you're missing a lot, especially in conversation. Okay, let's begin. I'm going to start with this ear, okay? Phalanx. Phalanx. Pilloried. Pilloried. Astrological. Astrological. Volcanic. Volcanic. Crystalline. Crystalline. Clinical. Clinical. Bejeweled. Bejeweled. Smattering. Smattering. Diagnostician. Diagnostician. Marmalade. Marmalade. Recollect. Recollect. Parable. Parable. Nucleus. Very well done. Now I'm going to switch to your other ear and repeat the exact same list. And again, please just tell me if you are straining to hear any words or any particular sounds within the words. Okay? I'll do my best to enunciate. Phalanx. Oh, I'm sorry. I completely forgot to whisper. Phalanx. Phalanx. Pilloried. Pilloried. Astrological. Astrological. Volcanic. Volcanic. Crystalline. Crystalline. Clinical. Clinical. Bejeweled. Bejeweled. Smattering. Smattering. Diagnostician. Diagnostician. Marmalade. Marmalade. Recollect. Recollect. Parable. Parable. Nucleus. 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 Skullduggery. Skullduggery. Popsicle. Popsicle. Catacombs. Catacombs. Wichita. Wichita. Smoke screen. Smoke screen. Smoke screen. Good. Were there any with which you had some trouble? Volcanic. Let's try again. Volcanic. 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 And what about bejeweled? Bejeweled. And smattering. 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 Nucleus. Nucleus. Diagnostician. Diagnostician. Clinical. 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 Yes, I thought it might be a good idea to retry some of those because I don't think I was getting quite as close to your ear as I was on the other side. That being said, missing the V sound in volcanic is pretty normal. It's a pretty dull sound leading the word, not as easily discerned as sounds we would aspirate heavily behind, like certain plosives and fricatives. So I wouldn't worry too much about that. I think most people get a lot of their V's and B's and D's and even some F's from context clues. It's pretty interesting. So all in all, I'd like to echo what your GP said. I think your hearing is in stellar condition, but like I said, we are all vulnerable to a reduction in our range of hearing as time goes on. So the best advice I can give you is to protect your ears. Our hearing is precious, but I don't want you to live in fear of some hearing loss, as it's almost impossible to live a full life without losing some of your hearing. Does that make sense? Okay, good. Just come and see me on a regular basis every 2 years, and I strongly encourage you to invest in some earplugs. Okay, it was very nice to meet you.